What are hemorrhoids, causes, types, and when to worry? Is it just a rash or something more serious? If you have been feeling itching, swelling, or spotting blood after using the toilet, chances are it could be piles. But what exactly are piles or hemorrhoids? Why do they happen? And when should you start worrying? Let's break it down simply without the awkwardness. And if you care about your health or someone else, do like, share, and subscribe. This is information everyone deserves to know. Hello and welcome back to the channel. I am Dr. Amit Goswami, a laparoscopic and bariatric surgeon practicing in Gurgaon with over 2 decades of experience. What are hemorrhoids? Let's break it down simply. Hemorrhoids are swollen, inflamed veins in the rectum or anus. But here is the interesting part. Everyone has hemorrhoidal veins supported by some cushion-like structures. They are part of our body normal structures. In a healthy state, these veins actually help support the anal canal and maintain control during the bowel movements. They are essential for things like preventing leakage or keeping everything sealed when it should be. But when these veins become swollen due to pressure, irritation or strain, that's when they turn into problematic hemorrhoids or what we commonly call piles. Now, what causes them? The most common culprits are chronic constipation, straining during bowel movements, sitting for too long, especially on the toilet, pregnancy, low fiber diet, obesity, and aging. There are mainly 2 types of hemorrhoids, internal hemorrhoids and external hemorrhoids. Internal hemorrhoids, these occur inside the rectum and often don't cause pain, but you may see bright red color during and after a bowel movement. External hemorrhoids, these are under the skin around the anus. They can cause itching, pain, swelling, and in some cases a hard lump called a thrombus hemorrhoids. This is a clot inside the vein. Now what about the grading? Internal hemorrhoids are classified into grades depending on how much they protrude. Grade 1, there is no protrusion, just mild bleeding. Grade 2, it prolapses during the bowel movements but go back spontaneously. Grade 3, need to be pushed back manually. And grade 4, mass is permanently prolapsed and may need surgery. External hemorrhoids, on the other hand, don't follow these grades, but are often more painful due to the nerve endings in the skin. When to worry or seek medical help? Not every hemorrhoid needs surgery or medical treatment, but here is when you should definitely see a doctor. Number 1, if you have a persistent bleeding. Number 2, if the pain becomes sharp, severe, or constant. Number 3, if you notice a lump that doesn't go away. Next is if there is leakage, discharge, or infection. Number 5 is or if you feel uncomfortable every time you pass stool. These symptoms can sometimes mimic more serious conditions like anal fissure, fistulas, or even colorectal cancer. So please don't ignore them. If you watched our previous video on piles versus fissure versus fistula, you know how these conditions can overlap, but knowing which is which helps in getting the right treatment at the right time. To wrap up, hemorrhoids are common, it is treatable and nothing to be ashamed of. If you manage your diet, stay hydrated and listen to your body, most cases improve with time or minimal intervention. If this video reminds you of someone you care about, do them a favor. Like, subscribe or share it. You never know who is quietly dealing with these symptoms. And please don't forget to check out our first video on piles, fissure and fistula differences. It's a perfect companion to this one. Until next time, stay aware, stay healthy. Thank you.